Hi, this is Dr. Neha Dolakia. I've just put this video together to explain what is a cataract, when should one get operated, which lens should one use, by which technique would one benefit, and some things that the patients have to say about their experience here. Okay. Hi, Rupa.
Yeah.
You've been operated for cataract how many months ago?
It's been almost a year now.
Almost a year, and we have put multifocal toric for you.
Yes, correct.
Yes. And how much was your number prior to the surgery?
I think I was like almost minus 11, 12, somewhere it was, yes.
And now do you wear glasses for distance?
I don't wear glasses
And
for
you wear
distance.
glasses for near?
No, I don't.
Are you happy?
Very.
Very happy. Okay. Thank you so
Very
much.
happy with the doctor also.
Okay. Thank you. Thank you. So what is a cataract? A cataract is basically just the opacification or clouding of the natural lens inside the eye. The common causes are due to aging. Other causes are diabetes, trauma, high myopia, or steroid use. The vision on the left is like a normal vision, and the vision on the right, it shows a hazy vision, which is exactly how vision in a cataract looks like. When is the best time to operate? As time passes, the cataract from medium soft becomes hard to very hard. Medium soft is like removing butter from the refrigerator and waiting for 10 minutes and then cutting it. It's more in our control. When it's hard, that means it's just the consistency like removing butter from the refrigerator and immediately trying to spread it on a bread. And the third is very hard, that is like shaving wood. So we don't want it very hard because it becomes very difficult to operate. Also, it causes a lot of damage to the eye while operating. Two decisions you will have to make: which lens to be implanted and by which technique. The lenses are monofocal, monofocal plus, EDOF, trifocal, or progressive. And by which technique? You have a standard phacoemulsification technique, or you have the newer latest, which is called the femto laser assisted phacoemulsification or cataract surgery, which is called FLACS. Now what are the timelines we are looking at? The surgery takes around 30 minutes, but we don't see the clock. We operate till we get the perfect result. It takes 7 days for 50% of the wound to heal, 14 days for 90% of the wound to heal, and 45 days for 100% of the wound to heal. One can watch TV, see the mobile, go for walks after day 2. One has to avoid crowds, avoid cooking, lifting any heavy weights. Basically, the restrictions are more or less like COVID. We don't want to catch any infection by being in any crowded area. 20 years ago, the choice was just coffee, one coffee, and a monofocal lens. Now you have, like Starbucks, many options. The IOL choice should be based on what the patient wants, whether he wants dependency on glasses or he would prefer not to wear glasses, his daily routine, how much is his distance work, computer work, near work, does he drive at night, cylindrical number, whether he or she has a cylindrical number or no, and what is the budget of the patient. So which lens should I implant? You have monofocal lens, which allows you to see distance, but intermediate and near you will need glasses. Monofocal plus allows you a little more than monofocal. EDOF lenses allows you distance and intermediate, but for reading you will need to wear a +1 reading number instead of a 2.5. Trifocal or progressive lenses allow you distance, intermediate and near, hence you become 90% less dependent on glasses. In both you get toric and non-toric options, that is with cylinder or without cylinder. Now if you see this chart, number 1 is monofocal. If you see, near is very less, intermediate is very less, and distance is high. The picture on the right shows you a clear lens without any rings or anything. Therefore you get good vision in monofocal. The second one is the EDOF lens, which allows you distance and intermediate. You have Vivity and Comfort Lentis. You will require a +1 reading number after you put this lens. The third lens is a trifocal lens, which you can see on the right. There are rings in the lens. It gives you good distance, good intermediate and good near at 40 centimeters. Number 4 lens is the Synergy by Johnson & Johnson. which gives you distance, intermediate, near, but near is still up close at 33 centimeters, and the in-between gaps of vision are also filled up by the EDOF element of the lens. The fifth lens is a mini-well lens, which is without rings, and the sixth lens is a lentis lens, which is also without rings. The sixth lens is by Johnson & Johnson called Iols. It's a monofocal plus lens. Instead of putting number 1, you can go for number 7, and you will require around a plus 1.5 reading or 1.25, and Rayner EMV covers around 1.5 reading, so you require just a plus 1 for near. That's number 8. So these are the main categories of lenses that we have. So the picture on the left is what the vision is like when a patient has a cataract. Everything is a little blurred and hazy. The picture on the right is the vision like through a monofocal lens, where the distance is clear. You can see the coffee and the croissant prices, but if you try to see the computer or the writing on the cup, that is near, is not clear. So monofocal lens, distance is clear, intermediate like computer, and reading like what's on the cup is not clear. So now on the right we have what a monofocal would look like, and where you can't see the computer and the writings on the cup, but on the left is an EDOF lens, which is like Vivity by Alcon. Another good EDOF lens is Comfort by Lentis, where you can see distance and intermediate, but so this is called functional near vision, and you can read on the cup cafe, but you can't read the fine print which is written below. So this is what it would look like in any EDOF lens, which could be Minivel or Comfort or Vivity by Alcon. So all these are EDOF lenses where you get good distance, intermediate, but for reading fine print you will need to wear a plus 1, approximately that kind of a number. Now you come to the third type of lens. If you see on the left, you cannot see what's written below on the cup, but on the right side you can see even the fine print. This is what the vision will be through a trifocal lens. In that you have one by Alcon called Panoptix, or you have another one which is Synergy by Johnson & Johnson. So everybody will definitely prefer to go for this lens because you can see distance, intermediate and near, all three. The question comes, this is the vision in the daytime, but what is the vision in the night time? So here in the night vision, on the left if you see, the vision is like through an EDOF lens, and on the right side you see the halo and glare. It's a little more, which is like the type of halo and glare you'll see in any trifocal or ring lens. So number 3 and 4, which are ring lenses, can give you this halo and glare. So for night driving it can become a problem.
Monofocal IOL, trifocal IOL, and continuous range of vision IOL. This is how his vision will get affected in each of the 3 alternatives. Monofocal IOLs will enable him to see distant objects clearly, but the objects will keep getting blurred as they come closer to him. Trifocal IOLs will let him focus on distance, intermediate and near objects, but the vision might be compromised at various points along the distance. Continuous range of vision IOL lets him focus on objects far through near across the distance. It helps him achieve clear vision irrespective of distance.
So lens number 4 gives you a continuous range of vision. Now ring lenses versus lenses which don't have rings. The rings in the IOL can cause halo and glare at night. Ring-free IOLs are almost free of halo and glare, and also the loss of contrast is less. So monofocal lenses look like this at the end of the surgery in the eye. The trifocal lenses which have rings look like this, which can be EDOF plus trifocal or just trifocal alone. And the third one is EDOF lenses without the ring, which look a lot like the monofocal lenses. Therefore, they don't give halo and glare. So monofocal lenses, let's see the pros and the cons. You will need to wear glasses all the time, but the vision is crystal clear. Monofocal plus, definitely little better vision than the monofocal, a more depth of focus, better range of vision. but you will still need to wear glasses like 1.52 for reading. EDOF lenses gives you distance, intermediate and part of near, so you may need to wear a +1 or 0.75 for reading. Trifocal lenses gives you very good distance, very good intermediate, very good near, and excellent vision. However, these lenses have rings, so it can cause halos and glare at night, especially while driving. And the Verilux lenses are like your progressive glasses, and therefore they can give you good distance, intermediate and near vision, and also not have the side effects like the halos and glare in the trifocal lenses, because these don't have rings. However, sometimes you can get little angel wing halos, which is like a small arc at the corners, but whether it is the halos and glare with the trifocal or with the Verilux, the slight angel wing halos, they do go away with time. A lot depends on the pupil size. It should not be less than 2.75 millimeters. If it is less, then you should not go for the higher lenses. Then monofocal plus becomes a very good option for such patients. So that in those cases we use 7 or 8. Toric lenses. The shape of the eye should be like that doorknob, but sometimes the shape is oval in shape. So if your eye has a cylindrical number, the vision can become distorted if you go for a spherical lens. But if you go for a cylindrical lens, the vision becomes very clear. The next decision you have to make is by which technique? By phacoemulsification or flax. Flax is femtolaser assisted cataract surgery. On the left side, you can see that you have to manually break the cataract and do the rhexis, while the other one is done by a laser. Some people call it robot. What is the advantage? It's more precise, it's a planned surgery, it's more safe. It's very good for cylindrical corneas. It's very good because it reduces surgeon error. Reproducibility error is less. It's good for harder cataracts, and the least post-operative number you can get after a flax. Why the precision? We take measurements on 3 different machines and we calculate the mean, median and mode. The surgery is planned such that the post-operative number is as low as possible. So here you see the mean, median and mode. We go with the median.
Cataract patients now have the following 2 options: standard cataract surgery or laser refractive cataract surgery. Standard cataract surgery starts with the creation of an incision through the cornea, utilizing a scalpel in order to allow the surgeon access to the cataract. LensX provides customizable laser precision and reproducibility in the creation of the incision. Capsulorhexis is the medical term used to describe the removal of the outer layer of the lens in order to allow the surgeon access to removing the cataract. This is the single most important step in your visual outcome. In standard cataract surgery, this step is performed by the surgeon manually creating a circular opening with a handheld instrument. LensX Laser offers your surgeon laser precision to create the circular opening and allows the lens placed to have the best possible effective lens position. This allows the patient to experience the most predictable post-operative visual results. Standard cataract surgery requires a phacoemulsification machine to segment and remove the content of the cataract. The goal of your surgeon is to reduce the amount of phaco energy used to remove your cataract. The LensX laser performs lens fragmentation, creating easily dissected segments for efficient removal with little or no phaco power. With the laser pulses utilized, the LensX laser provides the surgeon 43% reduction in phaco power and 51% reduction in phaco time compared to the standard cataract procedure. LensX laser refractive cataract surgery offers a new level of precision and reproducibility in ophthalmic surgery.
there is very precise centration of the lens. Now there is a new lens which is called Femtis IOL. It is just like the Lentis family, which is the Comfort and the M+. Here, in addition to the 4 clips, there are 4 additional clips which clip onto the eye, and therefore it gives a very precise location and centration of the lens. There is no vertical tilting or horizontal tilting or no rotation, and the lens position is centered on the visual axis right in the center, so the vision through that is very, very clear. Also, over the years, this lens tends to decenter less and shift less. The choice is finally yours, whether you would like to wear glasses or be 90% less dependent on glasses. You'd like to go for phaco or for flax. The average recovery period is 6 weeks to 3 months. Some cases it takes up to 6 months. Hope I have covered everything. Thank you very much for listening patiently.